Welcome to TvAgro. My name is Ana Patino. I am a veterinary doctor. Currently, I work in Otavet. Today we are going to talk about gestation in dogs and cats. Ready? Before considering the term of gestation, it is important to know at what time the patients would be suitable for this gestational process. Usually sexual development in dogs and cats occurs around 5 months to 6 months. It varies depending on the size of the breed, and in female cats sometimes it also varies depending on how many males are around and the environment where the patient lives. Since female cats are induced to ovulate, if there are many kittens around, it can happen that the estrus develops prematurely. Although this does not mean that she is already fit for reproduction. Something very important to take into account in the case that a planned gestation is being considered is that we must not only consider the age and reproductive status of our patient, but also the status in general. Metabolically speaking, gestation is a quite large energy expenditure. So it is important that before the dogs or kittens get to be in gestation they are in a good body condition. They are healthy. They are dewormed. They have up to date vaccinations and all that. It is very important not only thinking in the health of the females as mothers, but also in the health of the puppies and kittens that will be giving birth soon. The gestation usually has an approximate duration that is also an average depending on the breed of 63 days to 72 days. Usually one tends to divide the gestation in 3/3 and likewise it generates the fetal development. Before talking about the gestation, I would also like to talk about how is this process at the moment that the pregnancy is generated. Usually one of the biggest doubts that the owners have at the moment of looking for boyfriends for their dogs or boyfriends for their puppies is that it generates an effective reproduction. In cats it is a little more complex, because the ovulation is induced because the penis has some spicules that generate a lesion at the level of the uterine wall of the vagina. That generates induced ovulation. It is necessary to be very pending because throughout their reproductive cycle there is a point already except the puppy. Not always that the puppies are looking for it, or that she is staining and others are receptive to receive the puppy. Then usually what one recommends is that when we are going to have this type of crossing or this type of reproduction, we try that both the female and the male have an initial coexistence so that the reproduction is much more effective. Another way that is also done nowadays is in fact with artificial insemination. This is done by means of vaginal cytologies that tell us what stage of the extra cycle the patient is in, and the insemination is done as such. And this is a medical procedure that is usually done by a veterinarian or a person who is very expert in the subject. Ready? Because that also depends on whether the gestation is effective or not. The main initial gestational signs go from the behavior of the initial estrus, the reproductive status or the reproductive act that they have as such with their partner, and then they begin to generate a kind of physiological changes that metabolically speaking inside the patient are also reflected, where we notice a change of behavior at an internal level, because the acceptance and nesting of the fertilized ovum, or ready ovum, is also coming. The number of eggs that get to fertilize also depends on the number of eggs that the dog or the kitten has. It is usual that depending on the breed in cats and in dogs is the number of puppies that they can have. Usually in small breeds tend to be maximum 3 more could even be generated would be rare, and in fact it would also be risky for the mommy, because the puppies have to grow a lot. It is usual that this type of breeds have 1 or 2 puppies maximum. In the big breeds, on the contrary, it is normal that they have many puppies from an average of 5 to 8. Even depending on the breed, they can have up to 12 puppies. That also depends on the size of the puppy, how receptive she is, and how many ovules she has at that moment to fertilize. In the case of the Creole puppies, it also happens many times when they are in the street and we cannot control which puppies mount the puppy. It also happens that many dogs can be of one father and other puppies of another father. It also happens in the female cats that tend to be receptive to more than one male. Once the ovules arrive to be implanted at uterine level, the development of those fetuses begins to be much more constant. They start from the formation of all their organs, bone organs ready. When they become palpable, usually in the second third, more or less at the 50th day of gestation, one can already see the motility of the puppies on the kittens. One of the most noticeable signs, besides the clear bulging of the abdominal cavity, since as the puppies and kittens develop in the abdominal area, one day a marked abdominal distension is seen, is that the mammary glands also tend to swell up a little bit. In fact, naturally around the nipples they begin to lose hair, and they can also present signs such as lack of appetite, because at the abdominal level there is a compression of the stomach and the digestive system and all the organs that were there originally. It can also generate vomiting. It is not a very frequent sign in dogs and cats, but it can happen. And it can also generate initially a flow, that after a long time this flow still persists if it would be normal. We have to see how long the patients have been pregnant. Apart from this synology, a premature way to diagnose gestation in dogs and cats is the ultrasound ready. Nowadays it is not so reliable to perform blood tests, and it is not so biased, so qualified laboratorially speaking, that kind of blood tests, or urine, or many other things. As if there are human pregnancy tests. Let's say that the standard goal to diagnose gestation is the ultrasound can be done from day 35, even before what one normally sees gestationally speaking for the diagnosis of gestation. Is the heartbeat of the puppies ready? It is not so reliable to see the number of puppies, because sometimes they can hide one behind the other. However, something that is reliable is that once it is achieved, depending on the gestational stage where the ultrasound is done, the cranial diameter is measured, and usually with an index it gives us an approximate of the gestational stage in which the patient is and how much time is left to give birth. It is very important for us to keep in mind that it is important to perform ultrasound checkups on our patients when they are pregnant, because we will be monitoring the gestational growth all the time. That the heartbeat of the puppies and kittens is in order, that their development in general is fine, that the placenta and the uterus are fine, that our patient also has stability during the course of the gestation more. Because as I was telling you before, that is quite a big energetic load. It is important that when we have patients who are pregnant, their diet should also be modified. Usually one recommends that they eat at that time puppy diet, because nutritionally speaking it is much richer in many nutritional components that do not have those of adult, and can also help all that energy expenditure generated by pregnancy. Many veterinarians also recommend multivitamins. However, that depends on each dog, and its general condition is not always indicated, but it can still be done, and there would be no major problem. With respect to the feeding and nutrition, it is important because as it is a quite marked energetic expense, problems of severe malnutrition can occur because all its physiological organ is centered as such in the gestation, or it can even generate a very marked low of calcium that can generate a very important pathology at the level of the dogs and the kittens. Usually, if we have a good feeding and we are in the constant care of the pregnant dogs and kittens, this does not happen, but we have to be very pending ready of that also of the hand of our veterinarian. For the delivery, is usual that kittens and dogs do not require help. There are some losses that do require as veterinary recommendation cesarean sections or constant monitoring of the time of delivery. The time of delivery also varies depending on the breed. And it is important that if we are considering having our pet in gestation, we always go hand in hand with our veterinarian in case we have any complications or any questions. If you have any questions regarding the topic that was discussed today, you can contact us through our website, our social networks, both Facebook or Instagram. We also handle YouTube, and we will be ready to help you for anything you need.